Okay, thanks, Susan. All right, hello, good, and I hope you're all there. This is the first time that I've done this with Zoom with probably so many people. I've invited all my colleagues as surgeons. I've invited all my colleagues as critical care docs, emergency docs, and I got to a few of my fellows in the American College of Critical Care Medicine. That's the human side, and but I didn't really get a chance to get my members going into the American College of Hyperbaric Medicine. But they certainly, maybe we are recording this, I understand, so they'll be able to get it later. I have some, my national registry is an EMT, an advanced one. And I'm not a paramedic, not at this time, but it just takes so much of my time. Then I'm a certified firefighter and a medic with the fire department here in Oconee County, and a rescue specialist. And I'm really pleased to have Deirdre Chiaramonte join me today as we give this talk. And she is a diplomate in the American College of Veterinary Internal Medicine, certified canine rehabilitation therapist, certified veterinary acupuncturist, and a certified equine rehabilitation practitioner. So we certainly thank you, Deirdre, from the bottom of my heart for you helping me today on this as well. This is titled is the Targeted Pulsed Electromagnetic Field. You must most even know a little bit of what that is, but we want to go into some of the effectiveness of it in veterinary surgery, emergency, and critical care. And so our objectives are to provide a little history, and we need to just go right on. And then we'll go on to that to say that I've been doing this for 45 and now 48 years, more the time flies. I've been an intern, I've had many years in academics as well, in private practice. And I had a fortunate of being an NIH grant recipient, and I did some NIH research. And I've authored many procedures. Some of them you see there on your screen. Continuous abdominal closure is probably one of the things that I do every often. And I say, gosh, I really am glad I invented that one, but I really didn't. It was a surgeon that helped me, a board certified human surgeon, and he helped me continue this continuous closure. And that was back in 1976 when we published it in Surgery. And, nasal pharyngeal tubes, nasal oxygen, esophagostomy tubes, in nasogastric tubes. I'm just very blessed that I've had a chance to do these things. We have, with emergencies, a lot of things happen to us all at one time. And, as veterinarians, we're always challenged with whatever we do. Here we are with COVID even. And so we're challenged by all this. We've got to even talk considerations, it might be weekends, holidays. The costs may be unknown. And some of the cases we have are just very severe. And it's stressful. And we have to continue the care as well. So the post-operative patient or the post-trauma patient or unexpected problems altogether may be critical. And when that's critical, that is a big thing. And we have to deal with this. We have a patient like this who, that was her, what I just showed you. She was just bleeding to death and she had no airways. So we had to do a tracheotomy. And that was an emergent thing. And then here she is. This is Sarah. She said a little while later, now we had a big hole in her head that she got from her trauma. She had bleeding all over and she lost her eye. But this is her several months later. And that's her tracheotomy site. And so it's very, very rewarding to do this type of work. And so as a surgeon, as emergency doc, I always wonder, what can I do to improve the patient's outcome, whether I'm in the operating room or just on the floor. But looking at post-operative recovery, for example, we have critical care. It's really important. Oxygenation, hydration, nutrition, nursing, pain relief, physical therapy, hydrolyzed reduced water, which you may not know, but it's electrolyzed water, and it helps. It's 20 times more powerful than vitamin C as an antioxidant. Hyperbaric oxygen therapy, which we won't go into right now very detailed, but just to say that there are relationships between hyperbaric oxygen and targeted pulsed electromagnetic fields. We use photonic therapy to activate acupuncture points, as well as just locally, and low-level laser therapy, which I'm sure you're all very much familiar with. Well, it started with me when I was a young cowboy, and I really got injured badly in Texas in '69. I had a hemilaminectomy and a discectomy. That's my granddaughter there, and this is a few years ago. That's Joe, who just about killed me, but he's also a good horse too. And I'm also, as I say, a volunteer firefighter, and so I've been in these situations where I love what I do, but I unfortunately ruptured a disc at L3-4. This is in 2009, and it was a severe, severe injury to the point where, you know, obviously it was a ladder injury. So I had these several weeks of pain, and when I had the pain, I said, well, I'm going to need to see if I'm a neurosurgeon. I did, and an MRI. They scheduled a hemilaminectomy. They had a good friend, he is right here, Joe Thompson. He sent me an EVV coil or a loop, and so he said, try it. I'd never seen this before. It's the first pulsed electromagnetic field device I'd ever seen. Within minutes, I noticed I had a decrease in pain. Now, I was using it multiple times in the day, and what I found was it decreased my hydromorphone doses by 50%. I almost canceled the surgery, but I still had some pain. There was no question about that. So the neurosurgeon, I went and got the surgery. The neurosurgeon, when he came out of the operating room and, you know, saw me, because we knew each other. I've even helped him do surgery. He said, Tim, he said, how did you even walk? You had a very large amount of disc herniated material in your vertebral canal. And this convinced me to do some study. And here I am, one of these little guys in my head right here. And it's amazing what it does. And so let's just go into a little bit of the basics. Pulse electromagnetic field therapy then is an active electromagnetic waveform. It's pulsed. That's very important. And it's a shortwave radio signal. It's delivered by an antenna. There's the antenna right here. And it penetrates through the body. And it's by using first messenger, what it does is it does a lot of things inside, and we'll go into it later. But the shape, the strength, the electromagnetic waveform that they emit is very, very important because it's very strategic in what it does. It's like a surgeon cutting with a knife. The variables then are very different with all different kinds of these electromagnetic devices. This one that I have in my head here, the loop, the AVV loop, is only 1/1000th the power of a cell phone. There are no adverse effects. And in fact, it's now shown to be decreased brain aging. That's why I need it, okay? There are several waveforms that inducts a coupled electron waveform. Electrons are coupled in the body, by the way, if you knew that. When they decouple, that's when they die, when that cell dies. So there's transduction and activation of cellular enzyme cascades. So back in the 70s, they didn't even know much about that, but they started putting current into bone, and they found that it helped improve bone healing. In the late 70s, they had a non-invasive thing, and we started using in the 70s, and they were able to take it in beagle dogs and show that it would help with non-unions and treat the delayed non-union in beagles. And this is, of course, a research study. In the 1980s, a bone growth stimulator came out with Bassett and Pilla, and Arthur Pilla was the main guy who really was behind it. Bassett's a surgeon. And you know how sometimes as surgeons, we just like to be with good people, and then that helps us a lot. So this bone growth stimulator found that it was 70% successful in taking non-unions of the tibia, which are difficult. You know, it's usually a bone plate, lots of graft, et cetera, et cetera. And here we are, but it took a lot of hours in the day to do this. And Pilla knew, this is Arthur here, a later picture of his life when he was born, when he was alive. And he did a study, he did work, and this was at Columbia in New York, and they published it in '77. And so they are now starting to figure out what was the transduction pathways. And it took a lot of time to do that. But Pilla in 2006 finally published a really nice report, Biological and Medical Aspects of Electromagnetic Fields. And then it developed into the AVV loop. And the AVV loop started with a man that had a severe, severe burn. He died, but his son, David Soloff, was the guy that really kept asking Pilla to help because his dad had so much pain. And so Pilla finally went ahead and I guess relented And David and him formed the company. I'm not sure exactly all the details, but Avivi Technologies was born, and that's where the targeted pulse electromagnetic field really got going. And now, unfortunately, of course, when they have good things happen, you have other people with shirt tails. And there's a lot of pulse electromagnetic fields out there. Some of them are better than others. But if they can strategically do something like take what it does to target pain. And this is a study with the Assisi targeted pulse electromagnetic field, and it was delivering 100% of its targeted signal to create something for pain relief. And so this is a pain relief study here, and it showed, this is of course in humans, they have the salt pulse by de novo, and it's FDA approved, and it is being even used in COVID patients right now for pain and for decreasing swelling in the lung, etc. It was a faster pain reliever, and because it had been targeted, a lower amount. All these other devices didn't work quite as good. So what is this? Now, this is a waveform that's specifically a shortwave radio signal. And there's a carrier wave of 27.12 megahertz, and it's a shortwave frequency. It has in it pulse bursts of 2 microseconds, and there's 2 bursts every second. It induces a magnetic field, it induces an electrical field, and these are also bursted. They don't happen all the time. They are going on and coming on and going off and coming on and going off. That's one of the beauties about this, because as you will see, it's one of the things that it does. You're gonna now listen, I'm gonna just play this little thing here, and you'll see that, and as I turn this little device on, it actually shows a signal. With this signal, sensor. And there are others now. This is another signal sensor. If I turn this one on, it's not working. So here's, you can also use a radio. So this is a radio turned on to an FM station, and we've got we turn the loop on, and then we listen to it. I do hope that you could hear that. I'll do it again. So not only are you seeing the lights light up, but you're also getting the out of how much signal you're hearing. And if we do this where we move the loop away from the radio, just listen. Did you hear that? Do it one more time. So you can see it actually has a strength all the way out there, probably about 1.5 feet on this particular device right now. So it sends out this radio signal, and it goes out at least about 10 or so inches. And again, it depends a little bit on what it's going through, but all tissues, all bandages, all casts, all bedding, it goes through just like there's nothing there. It's a radio signal. But if you interfere with the radio signal by putting up another antenna, for example, this is like, say, a stainless steel bone plate, you must understand that you're going to have to send a signal in some other way than by bombarding it with something that's going to block the signal here. So we put the loop on these tibial plateau leveling osteotomy cases. We put them on the lateral side, and also on the front side and then the back side, but we stay away pretty much from the front side. And you can imagine any metal then will interfere with it. And of course, you know, there's now, Assisi has developed not only the bigger loop, 20 centimeters or so, they got a smaller one, and for osteoarthritis, and they've got a mat, for example, and so these things work, and you can plug this in and recharge it and use it. And of course, there's some studies that I want you to go back to 89 with, and this is by Fitzsimmons, and look at the calcium ion transport was increased. There was a 28% increase in cell proliferation. There was a 5-fold increase in IGF, and that was IGF-2. And the receptor expression was even better in the osteoblast. And all the way down to target growth factor, beta, through, again, messenger RNA was upregulated by 3-fold. Mesenchymal cells were even recruited, and there was cartilage differentiation. And this was all done and showed it even an upregulation again 100%, as well as collagen, as well as in the synthesis of in bone. Now, the soft tissues too, it works like this. There is some kind of a signal that we know that will get into the cells and work with calmodulin, and calmodulin and calcium then combine. Now, this is just one of the ideas about how this all works, but this has been really basically proven that it turns on consecutive-based nitric oxide synthetase. That upregulates nitric oxide and increases its signaling right there locally. So within anything within the loop, it's being affected. And this is a 15-minute cycle. And within just microseconds or milliseconds, you'll then start to see this signal. And it affects, of course, cyclic GMP and cyclic AMP and cytokines, and it decreases cytokines of a special kind we'll talk about in a minute, and growth factors. It increases blood flow. That's a critical thing because it increases nitric oxide, pulsed nitric oxide. It pulses it, and that's what does it to the bloodstream. It decreases pain and edema. It increases angiogenesis and tissue repair. It causes organ protection in brains and hearts. There's a really good heart study that was done in humans that with congestive heart failure, and they did better when they had the loop on their chest that was working versus the one that was a placebo. It increases organ function. It increases lung, heart, and Dr. Deirdre just sent me just last night, Chiaramonte sent me a report that was done in the journal that showed that it even increased, helped kidneys function that were chronic. So look at this. This is a study of a cell impact study with the brain of a rat. Then they took the CSF fluid, and out at 6 hours, they showed that what it did is it decreased IL-1 beta from an increase from the trauma way up here, 250 picograms per milliliter, all the way down to something that's almost like the control. So here's another study that was done with the ligated metacerebral artery, and of course in the rat model. And then they looked at, again, the cytokine and chemokine gene expression in these rat brains. And look at this. This is an important thing to understand, is it takes the pro-inflammatory cytokines and suppresses them. Look, it suppresses all of these pro-inflammatory cytokines. And it increases and upregulates, and most of these are the anti-inflammatory cytokines. It improves them, so it brings a reversal, and it's consistent with the NO-MO modulation that happens. To show that's how it works with nitric oxide, and that if they block the nitric oxide signal with L-name, then they saw no difference happening. And this is the blood flow. This is with pulsed electromagnetic field. The blood flow goes up. But if they gave L-name first, this is a laboratory rat study, and then they went ahead and gave the inhibitor, they blocked it again with the inhibitor, and then gave the pulsed electromagnetic field, there was no change in blood flow. But with, of course, with it intact, it increased blood flow. Now, guess where you think you'd probably like to use this? Any place you want to increase blood flow. Here's a study done with pulsed electromagnetic fields in a laboratory rat groin model. And this is in the control model, and there was poor vascularity. And here is the treated model that had a whole bunch of vascularity. And in a graphic form, when they then caused the loop, they did it as a microvascular graft. And they saw that even at 0.1 Gauss, they had blood flow increase versus none if this is the control. And of course, if they increased the Gauss to 2, it was the same. And then at 8 weeks, there's the control. This is, again, the amount of neovascularization happening in expressed in centimeters. And now it's much better with 1, a tiny bit better with 2. But look here, and here's the control versus here we are at 12 weeks out, the difference in blood flow. You can see, though, immediately it's taken an effect, and it does that through, again, increasing blood flow, vascularly wise. The tensile strength of wounds also increases. And this has been different studies done. Here's in wounds and here's in tendons. And in a tendon situation, if I'm a surgeon, don't you think I want to have these tendons heal better if I'm putting two tendons together that have been injured? Yes. And so it's consistent with the modulation of IL-1 beta, you know, suppressing that. And it also then increases, of course, growth factors. So these are scientifically proven things, and I'll just list them. Again, increases this constitutive base of nitric oxide in microseconds. It increases, causes vasal relaxation, and so you get increased blood flow. Microcirculatory wise, the tissue oxygen levels go up. Gene expression changes, and we see the inflammatory genes, inflammatory expression go down, and and of course the genes that are involved with anti-inflammatory cytokines goes up. And we get decreased edema within minutes, pain, minutes. I can tell you that from experience. And with some of the human patients that I've dealt with as well. They can talk to you. And they say, yeah, it's helped me. And I've seen this happen within just a few minutes. It increases the rate of angiogenesis, and it speeds up healing, as we noted. So here's some examples. In 2009, after I had my injury, I started using it. And Vivi, I had, of course, one of these. You plug in the wall, it goes up for 30 minutes. And so here's this little Trudy dog, who's a 6-year-old female Yorkshire, and she had a OHE. She needed to have that taken care of because she had a pyometra and septic. So we were putting it on her lung and, of course, on her abdomen. And this is what the nurses told me. They said, wow, little Trudy is feeling so much better. That's the first thing they noticed. And of course, we removed the nasal gastric tube and nasal oxygen tubes already. We had also just put her on a Crowe collar here. And so she's doing much better. Yes, she did get hyperbaric oxygen too. And we were, of course, using the targeted pulse electromagnetic field. So this is what nurses were reporting. They were reporting a decrease in pain and less wound edema, redness, gain appetite. And then they thought with Trudy that she just started, yeah, she was feeling much better. And of course, with a mechanism of injury, mechanism of action, we know that there is, again, pulse nitric oxide. It increases tissue O2. There's less infections, less systemic inflammatory response, less major organ failure, more survival, and there's more rapid recovery in both in humans and in dogs when they've done these studies. So we're still lacking studies, but this is what we are knowing. Within the last 10 years, of 11 years, you can see that we've got a lot of things that are going for us when we put a patient's got a head injury and we put this on to help with that, or a severe wound, or Samson, who had a very good outcome from he was progressively losing his deep pain. Before he got to surgery, he had lost all his deep pain. And so we're using these loops even preoperatively as well. So here is the disc. We can do a laminectomy. Now we do all the surgery. We put them on an anesthetic ventilator. We're doing all this. We use loops and headlight and do the best we can. And we'll use a loop or a mat. And we'll also, I guess that should be mat, M-A-T, because I call the loop a mat by a main name too. So we use hyperbaric oxygen. And of course, we know that the nurses are so important in doing this. And here's the hemi. There's the disc material, and a lot depends on how well you do this hemi, and a lot depends on how much disc material you get out, but it also, just this loop is so much helpful. And so here we are, we're doing the targeted pulse electromagnetic field every 4 hours. He gets hyperbarics, the owner's sent home with a loop. He's happy. He's doing it at home. He's gonna do it for several weeks. We send him home with all the physical therapy things he needs to do as well, and he comes back with a complete recovery. He made a full recovery, and that's important. So we have both a happy owner and a happy surgeon. And we know that there's been some really good studies, and Natasha Oldby there at North Carolina State and her whole group have done work to show that this is in dogs without any pain at all, no deep pain, that's gone, and they're taking them to the operating room. And this is 1 day after surgery. 4 of the 8 dogs in the study that had the pulse electromagnetic field working, this is a double-blind study, when they cracked the code, they found that 4 of 8 had come back with their regained their pain perception that next day after surgery. And they got their proprioception back as well. So this was a very positive study, and they had decreased pain at the wound site as well. Another study that was done, this was a study that was done at Animal Medical Center, and they reported, of course, that these dogs, there were 53 dogs, and they split them into a targeted pulse or a sham. And they did the studies, and they found that there was increase in the ability to decrease their coding after surgery. They were able to see better wound healing. They had better neurologic scoring as well. And so many of these patients survived and did well, and they had better within relatively good values. So I compare hyperbarics to target pulse electromagnetic field. As you said, I'm in the College of Hyperbaric Medicine, and I know that what it does is it increases reactive oxygen species and reactive nitrogen species. We also know from targeted pulse electromagnetic fields, it also stimulates some reactive oxygen species and reactive nitrogen species, that's the NO. And so it's doing these cell signaling things that are similar. So it increases oxygen tension, decreases edema, changes gene expression to a anti-inflammatory gene expression, reduces pro-inflammatories, increases the growth factors, and it increases bone marrow stem cells. We think, this is not proven, but just imagine if it increases NO, and that's how the hyperbaric oxygen works, is it stimulates stem cells by increasing nitric oxide synthetase, and that's how that makes stem cells. 20 times more stem cells with a hyperbaric chamber. And of course, with this little boy that had a bad brain injury, he went on to survive. He never got his sight back, but he went on to be a happy dog, and from a very severe head injury. And I've been a happy guy because I get a chance to use both. So you just how fast this may work. This is a little dog that came in with edema, and we know that, but we don't know where, except just listen to this dog's breathing. And notice this dog is not a happy dog, and he doesn't like people right now. So we think that there was probably a pharyngeal edema, not laryngeal per se, but pharyngeal because of the sound. It's probably maybe even epiglottic entrapment. We don't know. Or maybe, again, we just don't know what happened there. And then this is after he has a loop. Now, this is why the loop was just put on. Now just listen to him with about 10 minutes later. We didn't do anything else with this dog. All we did is put the loop on him. And, you know, we're kind of careful with him because we don't want to get too close because he's one of known to be an attacker. Listen to him now.
Hey, that's good. I think we're getting somewhere.
Again, the difference from this.
And I would blow by that if you
to
put
this.
a straight tip, if you could do a straight tip, and then it'll just put it in his mouth.
So you can see there's quite a difference.
We want that.
He's being a real quiet patient now. We went ahead and they had him induced, and they looked and found nothing could happen. Nothing was able to be found except edema that was going away, and so that's how he was treated. Probably, we don't know exactly. Well, here's Duncan. He's an English bulldog. Obviously, you know what these guys have, and we're 9 years old. The owner is actually the technician who is one of the best technicians I've ever worked with. And the dogs, this is post-op with a loop, and we're using we're using a small photonic light to help stimulate some acupuncture points and so forth. And then he's got a nasal tracheal catheter in, and he's got the loop on. And here he is post after we did his. Now, he had to have a trach. So this is before the trach. This is after. He went on to need a trach because he also has partial retinoid resection done, which I have just talked to one of my good dear friends, Dr. Crowe, just a little bit ago. He said, I've done so many of these retinoidectomies. And I said, yep, and I have too. And I'm just always afraid to do them but he did really, really well, eating well and everything afterwards, okay? So this is just where we're kind of just cleaning up his trach site, and there he is post-op. And here he is outside in about 90-degree weather in Georgia.
Boy.
Yep. And so he's breathing pretty well at this time. And you're going to get a little kiss there, all right? And yeah, and it's just amazing how well these guys do. Here's another really, I think, one that just really shows you how good this loop will work to increase healing. So this is a dog that had a meningoencephalopathy. Dog's name is Wit. And he came in with us with sepsis, and he had had high-dose steroids and cyclosporin for idiopathic meningoencephalopathy. He developed eruptive calcinosis cutis. He arrived hypotensive, very depressed, and early multiple organ failure and suspected systemic bacterial and fungal infection over this back. This is his back. From one end to the other, basically, he's like this, and it goes down very deep. So think of it like a third-degree burn, and that's another place where we use it. Well, anyway, he went on to the antifungals and bacterials and antibacterials, and of course, honey and sugar, and then we used the loop and hyperbarics, photonic therapy, bioresonance, and this is his foot. And now this dog is a competitive agility dog. This is after, while we're in the type of healing, and he's going on through his healing, and it's getting a little better. And then here he is, the pictogram that just shows that he's back to being better, and he's feeling better, and now he's back to full function. And I want you to just watch him work. This is after all this happened to him. So he came very close to not doing well. That's him barking, by the way, when you hear him doing his job. He's just so happy. And I am so happy for him, because here is a device that improves healing and blood flow and helps with septic organs, including the lung. That's why they're using it in COVID patients right now, to help improve lung function, because it decreases inflammatory cytokines. Look at him go. Look at him go. All right, Wit. Now, he's a little slower than he used to be, they say, but he's still in competitiveness. He's so happy. He likes what he does. And I sure hope you liked that little video that they showed me. Here's a fast case that just is a dog with head injured. You can see he's very depressed. He comes in one night and he's got these his wounds. And this is him 3 days later, but I just noticed the difference in just the way he looks. And this is a post brain injury. We think it was just more of a concussion, contusion, and whatever, we don't know, but he never lost consciousness in our hospital. But at the same time, you can see the wounds. Look at how different they look in just 3 days. So as a surgeon, I guess I use them for about everything. I apply a loop intraoperatively, even with a GDV that's rotated. Why not? I just take this little stuff right here. This is Technicare, and it says right on the bottle, non-toxic. So we scrub it, we scrub the loop, scrub it all up, and then lay the loop right into the operating field. We can do that. And it's amazing how you can see sometimes the change in blood flow, where it's an organ like a bowel that's been rotated, or again, a stomach that's been rotated. It really makes a difference. So we're using it in all kinds of perforations, inflammations, foreign bodies, traumas, blunt and penetrating, thoracic, abdominal, brain, cord, fractures, luxations, muscles, tendons, bite wounds, burns, especially there as well. And, it could be a very bad burn. It could be a gastric dilatation. It's one of those things you just don't ever really know. So here's a case, for example, it's a dog that was injured and has very big holes in his lung from the torn rib. And we're just now showing where these holes are with a video. And guess what? I'll have then the technician take that loop, if not used in the operating room, but immediately then post-operatively and use it. So you can immediately use it in a post-operative area. Here's the post-PDA duct ligation. And of course, we lay it on their chest post-operatively. Any elective surgeries, you can use it for that. Because I just definitely have fun doing surgery. And I have more fun when I know that my patients, whether elective or non-elective, I get help with that. So this is what the nurses comment on from records that I pulled. No, I didn't. This is not a study. This is just telling observational what we see. This is a case-by-case basis, and I just pulled out some random records and just looked at what they wrote. Less fentanyl was needed, less hydromorphone needed, wound swelling decreased, less need for bandage change, getting up and moving better, eating now, has less nausea, definitely seems to feel better, sleeping better. It helped his breathing significantly. These are just off the chart. And then when we looked at numbers of things like NSAIDs and opioid use, we found that it decreased that by about 50% again. And of course, that was a pain score of 2 to 3. And their appetite did return sooner, based on other cases that would be similar. What about cats? Those have been all dogs mostly, and some people stuff. But what about, and rats and stuff? What about cats? Well, I have affectionately got 2 cats myself, and this is Tiger. And she just loved the little loop here. She just kind of sniffing it. So we'd push on the button, and it would send out a signal. So where have we used it? We've used it post-op and post-trauma. Many bite wound cases, just a lot of them. Viral conditions, anti-inflammatory, asthma. And especially with cats, they really turn on to IL-6 and TNF and IL-1 beta. These are inflammatory cytokines. And so even in FIP, we've used this just to help lay on the cat's abdomen, as well as if you have pancreatitis or renal disease. I'd like to see a study done with renal disease, because in humans, there is a difference when you see it applied to kidneys. In humans, they have increased kidney function. Pancreatitis, increased blood flow. We think we know that really helps when there's pain. We don't really know about all the different things that happen with cytokines because we haven't been able to look at that. How about long-term use? No side effects. So those patients that have osteoarthritis, and this is just a study that was done at the American College of Physicians, and they found that therapeutic technology using these devices like this one, there was nitric oxide release creating a cascade of events. And it took these people, and there were just a number of them. There were 4 hypertensive volunteers that were on, they were pouring out a lot of protein in their urine. And within just a 14-day study, they showed a mean protein excretion reduced by 36%. And of course, that really makes a difference. And their creatinine levels also came down. Let's jump a little bit into other areas of pain in the emergency side of things that we could use. This dog had a Fibro Sarcoma, and the dog's name is Crowe, and 8.5 years old. And Dr. Burr, a really good friend of mine, called me up and said, Tim, I've tried taking this and cutting it off. I've tried lasering it off, and now it's coming back again for the 3rd time. What can I do? And probably the owners don't want you to come, unfortunately, and take out all this mass here. And I just said, hey, what about just putting on the loop? Putting on the loop. And so they put the loop on. They started doing it twice each day. And the first thing they said was, it appears is that he is much more comfortable. Then the tumor started to go away. It literally went away. In 2 weeks, the owner said the mass was getting smaller. They verified it. And then Dr. Burr saw the dog, and then he had me, he was so excited, he had me come around 3 months out, and I saw there was no tumor present in the dog's mouth at all. So we said, hallelujah. We called Dr. Pilla, let him know. He was all excited. So what happened? We don't know, except this, unfortunately, the tumor started coming back when they stopped using the loop. And then they euthanized the dog. Here's Samson. He's a 12-year-old with a very severe osteolytic tumor mass, presumptively being a hemangiosarcoma, and in his right humerus. And the owners had a very nice dog, but he had severe osteoarthritis. So we started putting the loop on his bone cancer as well. It's a presumptive. We never got a diagnosis. We just had a very osteolytic lesion, very severe. And we also seen that we put the loop on his other areas to help him with his osteoarthritis. He started running around. I was petrified, really. It was a happy dog. And the owners had him for 14 more months. And then he was euthanized because it got so bad. But he did have 14 beautiful months, and on his 15th month, they put him to sleep. So you see, here's a study done in people in a breast reduction study, and we had an active and they had a sham group, of course, to their breast reduction study. And when they broke the code, this is a double-blind, randomized trial, they showed that in the pill count for Percocet was drastically decreased. Dose. And so another one where they had a active and a sham, the same kind of thing. They had decreases in the amount of necessary pain relieving materials. And I just share with you something that's just near to my heart is my wife. She's had cancer now for 2.5 years, and the bone pain is what hurts her the most. But we apply the loop like this onto her bone cancer areas, and it's been very, very, very helpful. She's now in remission. She just has the cancer bone pain that's still left over. Here's Storm, 13 years old, miniature schnauzer. This is a big tumor. I don't know why they didn't come in to see me sooner. And I just told them we can probably try. We might have the dog die on the operating table. This is so big. It's about the size of the dog. This is us doing the surgery. This is him post-operatively. We never did a histopath on him. We don't know because she only wanted to get some time with the dog. Here he is, post-op. He's a happy dog. Well, he looks kind of happy, but here he is post-op. He got his suction drains in. At 5 months out, he had some really significant recurrence, and we tried to do a surgery, and then he literally died on that operating table. But the owner was just so thankful she had 5 months with him. Here's Gracie, owned by, again, my dear sweet friend, Hilty Burr, Dr. Burr. And he noted that his dog was not feeling as well and having some compulsive circling and difficulty eating, had some depression and pain. Went up to UT in Tennessee and had an MRI and showed a large tumor, much larger than that one, the pituitary tumor. She had then, Gracie started to have this loop put on her head, and he put the loop on, and she got feeling better. No circling, the appetite improved. She appeared so much better. So it's probably a way associated with the inflammation with the tumor, as well as, of course, the edema. Maybe it helped with the tumor size itself. We don't know. We didn't follow it. But it's convinced that she had several months of life, very good life, with quality life in that time. So this is something that also could be used in a lot of palliative conditions. Why would it help decrease tumor size? Well, we know cancers, this is, of course, the Warburg effect. That's Otto there in 1931. He won a Nobel Prize for this work, that he showed that if you take and decrease the oxygen levels in cancer in mice, they increase their cancer growth. And then he just felt, well, it's a hypoxic event. And yes, we do know that cancer works on the glycolytic pathway and uses less oxygen to do what it needs to do. So if you improve oxygen levels, what do? You improve the immune system. You may improve the metabolism. You know that it increases tissue oxygen levels. And of course, maybe the cells then do much better, real cells with better signaling. So maybe there's some other problems associated with cell signaling and why cancer even occurs in itself. We don't know. All we know is that cancer cells are a different kind of animal, but at the same time, there's edema and swelling around it, and we know that we can help with that, and we can help with the pain. And here's just a typical TPLO. Yes, it didn't go quite as well as I'd like. I'd love to have had a little bit better apposition right there. So we used a loop in the post-operative period. We apply it in an AP and a PA in a lateral to medial direction for this loop. And we apply the loop, multiple times in a day. And if the owner wants to do it really many months, a long time, that they can. I mean, just is really important to do that. So just to show you that we also have, back in the day, there was this large device. And we have one in our practice just right down the street from us here. And sends out a pulsed electromagnetic signal that has been shown by Richard Markall to be a very good thing for osteoarthritis. And I've even been in it myself, and they've wanted to do a total knee on me for the last 3 years. And I'm still a working firefighter. I go up ladders and all that stuff because I went into this and had 9 treatments twice now. And it decreased my pain. And I'm being the rough dog here in this talk right now. And my barking has gotten a lot better. So maybe Dr. Chiaramonte, you want to say a comment here?
Yeah, absolutely. So just in some of the arthritis pilot work we've done in dogs, one, we're just culminating the statistics right now. The other one, we compared it to dogs currently on non-steroidals, dogs not on non-steroidals. And actually what was interesting is that any dog that was a virgin to any type of treatment for the arthritis and the pain did phenomenally well with just the loop added to it. And so we hope to sort of comb back through some of that data and compare it to the second pilot that we did. But also we're really excited to start on a feline osteoarthritis study at Virginia, Maryland. We had hoped to do this a year ago. Things got a little sidetracked and COVID then shut everything and everybody down. But we are going to follow, besides pain and owner assessments, we're going to follow kidney values just to make sure that any cats that do have renal issues, that we can hopefully improve them, but at least not be a detriment to them. So we're pretty excited about that. If anybody lives in the Virginia, Maryland College of Vet Medicine area, send all your arthritic kitties to them for a study.
That's a great area. I know that osteoarthritis has been a very big thing with kitties, and I think it'll be a big helpful. Here we are, just a summary then of where we've used the targeted pulse electromagnetic field. This kind of loop, of course, and not that great big large machine that I just showed you, because that is more antiquated now. Look here, it's for pain. It's for anything with swelling. It's anything that's ischemic. The risk of developing these also, so postoperatively. I've had dogs where they've come long ways to have their gallbladder taken out. And I've talked to the referring vet, and they say, "What can I do to help with the pain?" And I say, "You got a loop? If you don't have one, get one." But in those cases, they've gotten loops in their practices, and they're starting to use it, and they say a lot less pain. And gallbladders hurt sometimes. Sometimes they don't, and they're silent, and they kill. But at the same time, we know that even in the post-operative period, that really helps. So we know that the risk of infection and dehiscence and all those things can happen with wounds. And we know that this really helps with wounds. And here again, this is like a big giant wound, okay? Here's Emma. She's a quadriplegic dog and quadriparetic, and she had to have a dorsal and a ventral decompression stabilization with a little bone plate put in her neck. And then here she is, and she looked like she likes to wear her little bit of a device here with her little loop. And this is an older one of the BB loops, if you will, a CC now. And this is 1 year later, full recovery. She's doing well. And of course, I'm a happy surgeon too. So we've got some, this is me. If you got questions, you can call me at my cell number here, 706-296-7020. You can also go to my email address. I just want to show you this one last case. This is a dog that had an early wobbler disease. This is a loop that's put on the dog's neck. And then we're watching the dog walk. And, there's some problems with this dog. And she's 15 months old. Her name is Rainey. She's on YouTube. You can go look at her if you want. And this is her post after wearing the loop, 2 days, 3 days, 4 days. This is 2 weeks later after doing this. And this is the owner. And she's so happy, and she's walking around, and I don't know which dog is actually Rainey in this picture. And Dr. Bird took this for us from up there at Lake Chattooga Animal Hospital up in Young Harris, Georgia. And I can't tell. I really can't. I really can't tell which dog is good. And so here I am wearing my loop and eating some, maybe a little dessert. I'm diabetic, and I've been using this on me to help with my microcirculation things. And then, of course, as we get to this, I'm just going to say I'm going to thank my family. And I want to thank Joe Thompson, again, who got me started, and Dave Soloff, and Arthur Pilla, and CC Animal Health, and especially Deirdre, you're just a blessing. And then Sean Hagberg, who's just brilliant. He's a PhD in biophysics, and he knows a lot of, and of course, all the doctors and everybody that have helped me. And there is a Arthur Pilla Research Foundation that you can help with young investigators in bioelectromagnetics and biomagnetic association too. And then my family, I'm just thankful for them. And please pray for all those that are involved now with all the fires. And we know that if you have any patients out there, like you're in California, you got any burn patients, please get them in on a targeted pulse electromagnetic field. So that'll help them with their burns. If you have a hyperbaric chamber, of course, use it for burns. We know that it really helps. And here's two of my little grandkids talking to their, I'm not a fire chief anymore now. I'm not a chief. I'm just a captain at this point. God bless you guys. Thank you so much.